CNA Practice Test Questions and Answers. A CNA is recording the 24-hour urine output of a patient with kidney issues. What 24-hour urine value would warrant a report to the nurse? A. 800 cubic centimeters. B. 1,400 cubic centimeters. C. 1,900 cubic centimeters. D. 600 cubic centimeters. Correct answer, D. 600 cubic centimeters. The normal 24-hour urine output for a patient should be between 800 and 2,000 cubic centimeters. A value of 600 cubic centimeters could indicate a complication, e.g., dehydration, kidney dysfunction, and should be reported. A resident drinks 8 ounces of milk during lunch, but the standard measurement of documentation in the facility is cubic centimeters, cc. What value would the nursing assistant record? A. 240 cubic centimeters. B. 360 cubic centimeters. C. 120 cubic centimeters. D. 8 cubic centimeters. Correct answer, 240 cubic centimeters. 1 ounce is almost equal to 30 cubic centimeters. Thus, 8 ounces times 30 cubic centimeters equals 240 cubic centimeters. You are caring for a patient with a strict dysphagia diet. Which item on the patient's tray would you question? A. Peanut butter. B. Chocolate pudding. C. Applesauce. D. Mashed potatoes and gravy. Correct answer, A. Peanut butter. Patients with dysphagia require pureed or soft foods. Peanut butter's sticky texture poses a choking risk. There is a sign that says NPO on your patient's door. You know this means A. The patient is at risk for falls. B. The patient is under isolation precautions. C. The patient can only have liquids. D. The patient cannot have anything by mouth. Correct answer, D. The patient cannot have anything by mouth. NPO, Latin nil per os, means no food or fluids orally. Your patient has a low pulse, seems slightly confused, and has sweet, fruity-smelling breath. You suspect A. Hypertension. B. Hypoglycemia. C. Hypotension. D. Hyperglycemia. Correct answer, D. Hyperglycemia. Sweet/fruity breath, ketoacidosis, confusion, and low pulse are signs of hyperglycemia, high blood sugar. Which of these would be inappropriate when caring for a diabetic patient? A. Keeping the patient's feet clean and dry. B. Carefully monitoring food consumption. C. Ensuring the patient has snacks. D. Offering a thermal foot soak. Correct answer, D. Offering a thermal foot soak. Diabetic neuropathy reduces sensation. Hot water could cause burns. A fractured hip is A. The most difficult injury to recover from. B. The most frequent injury when a resident falls. C. The most expensive injury for rehabilitation. D. The injury that generates the most complaints. Correct answer, B. The most frequent injury when a resident falls. Hip fractures are common in falls among elderly residents. As a CNA, you become an advocate for residents. This means you A. Help them make care decisions. B. Ask questions about their care. C. Complain about disliked actions. D. Communicate their needs when they cannot. Correct answer, D. Communicate their needs when they cannot. Advocacy involves representing residents' needs to the healthcare team. You should be careful when changing underscore, as this is a common site for discarded needles. A. Bed linens. B. Clothing. C. Bath towels. D. Trash bags. Correct answer: bed linens. Needles may accidentally be left in bedding after procedures. When conversing with a dysphasic patient, it is important not to A. Finish their sentences. B. Encourage use of senses. C. Praise their efforts. D. Use visual aids. Correct answer: finish their sentences. Finishing sentences undermines their autonomy. Patience is key. Which of these is not true about condom catheters? A. They are a treatment used to avoid urinary tract infections. B. They are internal catheters and not as effective as external catheters. C. They are more effective if pubic hair is removed around the area. D. They should be changed frequently. Correct answer: B. They are internal catheters and not as effective as external catheters. Condom catheters are external devices. The other statements are accurate, e.g., frequent changes reduce infection risk. After assisting a resident onto a bedpan, it will help to make the patient more comfortable if you A. Turn on the television for distraction. B. Raise the head of the bed. C. Lower the head of the bed. D. Have a trusted loved one assist. Correct answer: B. Raise the head of the bed. Raising the head mimics a natural sitting position, improving comfort and facilitating elimination. A resident has expelled brown fluid from the rectum, excessive flatus, and light abdominal cramping. What is the likely cause? A. Blood clot. B. Stroke. C. Heart attack. D. Enema. Correct answer: D. Enema. These symptoms are common after an enema. Severe cramps would require nurse notification. Which is not a reason to notify the charge nurse about a resident's ostomy bag? A. Pus draining from the stoma. B. Sudden increase in stool volume. C. Bulging skin around the stoma. D. Temperature of 98.8 degrees Fahrenheit. Correct answer: D. Temperature of 98.8 degrees Fahrenheit. 98.8 degrees Fahrenheit is normal. Pus, bulging, or sudden stool changes indicate complications. The medical term for a device with two plastic prongs delivering oxygen via the nose is A. Oxygen diffuser. B. Nasal shunt. C. Nasal antihistamine. D. Nasal cannula. Correct answer: D. Nasal cannula. A nasal cannula is the correct term, other options are unrelated. A resident with venous stasis develops pressure sores under elastic stockings. The likely cause is A. Allergy to elastic. B. Wrong treatment. C. Wrinkles in stockings. D. Scratching legs. Correct answer: C. Wrinkles in stockings. Wrinkles create pressure points, leading to skin breakdown. To avoid pulling a catheter when turning a patient, tape the tube to the patient's A. Knee. B. Outer thigh. C. Bed frame. D. Upper thigh. Correct answer: D. Upper thigh. Taping to the upper thigh prevents accidental dislodgement during movement. What is the standard unit for measuring urinary output? A. Milliliters. B. Cups. C. Ounces. D. Liters. Correct answer, A. Milliliters. Milliliters, ml, or cubic centimeters, cc, are standard. What should you do if unsure about safely moving an obese patient? A. Try alone. B. Ask family. C. Let the patient move themselves. D. Ask another aide. Correct answer, D. Ask another aide. Teamwork prevents injury to both patient and caregiver. Padded side rails are primarily used to A. Protect from injury. B. Prevent skin breakdown. C. Keep in position. D. Restrain. Correct answer, protect from injury. They prevent falls or entrapment, not restraint. A resident has fever, swelling, redness, and chills. This likely indicates A. Arthritis. B. Infection. C. Allergy. D. Food poisoning. Correct answer, B. Infection. These are classic signs of localized infection, which is used to protect a resident from immediate self-harm. A. Isolation. B. 24/7 watch. C. Additional staff. D. Restraints. Correct answer, D. Restraints. Restraints are a last resort with a physician's order. Proper handwashing includes A. 15 seconds of friction. B. Antibacterial soap only. C. Longer friction if no lather. D. Using a paper towel to turn off faucet. Correct answer, D. Using a paper towel to turn off faucet. Prevents recontamination from faucet handles. Axillary temperature readings are lower because A. Deeper placement. B. Shorter time. C. Not inside the body. D. Taken at body's back. Correct answer, C. Not inside the body. Armpit, external, readings are less accurate than oral/rectal. Correct step for radial pulse measurement. A. Press neck with 2 fingers. B. Press radial bone with fingers. C. Count erratic pulse for 90 seconds. D. Count 30 seconds and triple. Correct answer, B. Press radial bone with fingers. Radial pulse is measured at the wrist's radial artery. False statement about rectal temperatures. A. Insert 1 to 1.5 inches in adults. B. Slightly higher than oral. C. Mercury thermometers preferred. D. Wipe rectum after. Correct answer, C. Mercury thermometers preferred. Mercury thermometers are unsafe and no longer used. Pulse cannot be taken at A. Behind the knee. B. Back of the head. C. Inner wrist. D. Side of the neck. Correct answer, B. Back of the head. No major pulse site exists there. Incorrect about Heimlich maneuver. A. Perform if coughing violently. B. Hands between xiphoid and navel. C. Make a fist. D. Self-perform with a chair. Correct answer. Perform if coughing violently. Let coughing continue, intervene only if choking is silent. Inappropriate for reducing restraints. A. Threaten restraint use. B. Redirect/distract. C. Identify agitation triggers. D. Calming activities. Correct answer. A. Threaten restraint use. Threats are unethical, restraints require physician orders. Transmission-based precautions are: A. Standard for all residents. B. Added for communicable diseases. C. Used only in epidemics. D. Less strict. Correct answer. B. Added for communicable diseases. They supplement standard precautions for infections, e.g., MSA. Stage 4 decubitus ulcer involves: A. Superficial blackened area. B. Open area with redness. C. Skin redness. D. Damage to bone/tendons. Correct answer. D. Damage to bone/tendons. Stage 4 is full-thickness tissue loss with exposed structures. Heat application causes blood vessels to: A. Narrow. B. Remain same. C. Dilate. D. Constrict. Correct answer. C. Dilate. Heat increases blood flow to promote healing. Systolic BP is recorded when: A. Last sound heard. B. Pulse unfelt. C. 30 mm of mercury above pulse. D. First sound heard. Correct answer. D. First sound heard. Systolic, top number, is the first Korotkoff sound. A fracture bedpan is used for: A. Hip surgery patients. B. Traction patients. C. Back injuries. D. All of the above. Correct answer. D. All of the above. Its low-profile design suits patients who cannot lift hips. When making a bed, raise it to: A. Hip level. B. Waist level. C. 12 inches. D. Do not raise. Correct answer. B. Waist level. Prevents back strain during bedmaking. Normal adult BP is: A. 180/80. B. 116/70. C. 134/90. D. 80/40. Correct answer. B. 116/70. Normal BP is 120/80 mmHg, per AHA guidelines. Patient's head elevated, legs bent/straight. A. Fowler's. B. Rose's. C. Sims. D. Trendelenburg. Correct answer. A. Fowler's. Fowler's position aids breathing and comfort. Proper body mechanics for lifting: A. Bend waist, knees locked, use arms. B. Bend waist, knees unlocked, use arms. C. Bend waist, flex knees, use legs. D. Bend waist, unlocked knees, use back. Correct answer. C. Bend waist, flex knees, use legs. Leg muscles are stronger, avoid back strain. Alcohol sanitizer is best used when: A. Catheterizing. B. Hands not visibly soiled. C. Hands have blood. D. Hands visibly dirty. Correct answer, B. Hands not visibly soiled. Soap and water required for visible dirt or blood. Incorrect about gloves. A. Use latex exclusively. B. Wash hands before/after. C. Avoid outer layer contact. D. Peel gloves inside out. Correct answer, use latex exclusively. Latex allergies are common, alternatives exist. If a resident falls, do not A. Document details. B. Inform the nurse. C. Move to a chair immediately. D. Keep resident still. Correct answer, C. Move to a chair immediately. Moving could worsen injuries, assess first. Tetraplegia is also called A. Quadriplegia. B. Hemiplegia. C. Paraplegia. D. Cardioplegia. Correct answer, quadriplegia. Both terms mean paralysis of all four limbs. Incorrect about BP measurement. A. Feet on floor. B. No talking. C. Higher in mornings. D. Lie with feet elevated. Correct answer, D. Lie with feet elevated. Feet elevated alters BP accuracy, sit upright. Symptoms, dizziness, BP less than 90/60ths, cold skin. Likely. A. Hypertension. B. Hypothermia. C. Hypoglycemia. D. Hypotension. Correct answer, D. Hypotension. Low BP causes dizziness and cold, clammy skin. Normal child pulse rate. A. 70 to 120. B. 60 to 100. C. 55 to 105. D. 40 to 60. Correct answer, 70 to 120. Children have faster heart rates than adults. Alcohol sanitizer is not for A. No soap/water. B. After walking resident. C. Visible dirt. D. Handling clothes. Correct answer, C. Visible dirt. Visible dirt requires handwashing with soap. Incorrect about tympanic thermometer use. A. Use speculum cover. B. Remove earwax first. C. Wait for signal. D. Pull ear to fit snugly. Correct answer, B. Remove earwax first. Do not remove earwax, it may damage the ear. If a nightshirt falls on the floor. A. Ask resident if they want it. B. Place on chair, get clean one. C. Tell resident to wear it. D. Discard, get new one. Correct answer, D. Discard, get new one. Floor contamination risks infection, replace immediately. Convulsions are linked to A. Spasm. B. Tear. C. Seizure. D. Sprain. Correct answer, C. Seizure. Convulsions are involuntary muscle contractions during seizures. Shortened muscle tissue causing stiff joints. A. Perforation. B. Contracture. C. Which? D. Rupture. Correct answer, B. Contracture. Contractures result from immobility, e.g., post-stroke. CNA scope for IV therapy. A. Administer for. B. No involvement. C. Prepare solution. D. Monitor drip. Correct answer, D. Monitor drip. CNAs may observe flow rate but not adjust IVs. Finding a resident smoking. A. Stop them, explain policy. B. Allow once, report later. C. Call family. D. Ignore first time. Correct answer, stop them, explain policy. Immediate action prevents fire hazards. 240 milliliters juice every 2 hours equals A. 12 ounces. B. 8 ounces. C. 5 ounces. D. 4 ounces. Correct answer, B. 8 ounces. 8 ounces times 30 milliliters per us equals 240 milliliters. Not used for contractures. A. Hand roll. B. Repositioning. C. Bandaging. D. Physical therapy. Correct answer, C. Bandaging. Bandages do not treat contractures, therapy and splints do. Hypertension means A. High BP. B. High anxiety. C. Hyperactivity. D. Tense muscles. Correct answer, A. High BP. Hypertension equals systolic greater than or equal to 140 or diastolic greater than or equal to 90 millimeters of mercury. Cleaning a catheterized perineum. A. Meatus outward. B. Rectum to scrotum. C. Use peroxide. D. Rectum to meatus. Correct answer, A. Meatus outward. Prevents fecal bacteria from entering urethra. Incorrect denture care step. A. Rinse thoroughly. B. Place on tissue. C. Pad sink. D. Wash hands. Correct answer, B. Place on tissue. Tissues can lead to loss/damage, use a denture cup. Resident loses dentures. CNA should A. Notify nurse. B. Document loss. C. Contact family. D. Stop meals. Correct answer, A. Notify nurse. The nurse oversees documentation and next steps. CDC recommended handwashing scrub time. A. 60 seconds. B. 10 seconds. C. 20 seconds. D. Until clean. Correct answer, C. 20 seconds. 20 seconds with soap ensures germ removal. Transfer gate belt safety excludes. A. Avoid frayed belts. B. Place around waist. C. Ignore body mechanics. D. Rock/pull gently. Correct answer, C. Ignore body mechanics. Proper body mechanics are always required. Accurate respiration count method. A. Resident counts while CNA measures. B. CNA watches abdomen and timer. C. Resident counts to 30. D. CNA uses stethoscope. Correct answer, B. CNA watches abdomen and timer. Count for 30 seconds, times 2, without patient awareness. Most accurate weight measurement. A. After meals. B. Multiple scales. C. 3 to 4 hours post-meal. D. Same time daily. Correct answer, D. Same time daily. Consistency reduces variables, e.g., clothing, meals. Oral temp after cold drink, wait. A. 3 to 5 minutes. B. 15 minutes. C. Immediately. D. 20 to 30 minutes. Correct answer, B. 15 minutes. Allows oral cavity to return to body temperature. Dispose of PPE after MRSA care. A. Dirty utility. B. Hallway. C. Patient's room. D. Next patient's room. Correct answer, C. Patient's room. Prevent spreading infection to other areas. Decubitus ulcer equals A. Pressure sore. B. Perforation. C. Cyst. D. Tumor. Correct answer, pressure sore. Caused by prolonged pressure on skin. Oral temps are common because A. Only method accepted. B. Cheapest. C. Easiest/least invasive. D. Most accurate. Correct answer, C. Easiest/least invasive. Convenience and patient comfort make oral preferred. Transfer wheelchair to chair, stand. A. In front. B. Right side. C. Behind. D. Left side. Correct answer, A. In front. Allows safe pivoting using gait belt and body mechanics. Neglectful showering assistance. A. Explain steps calmly. B. Test water temperature. C. Leave resident alone. D. Reassure. Correct answer, C. Leave resident alone. Leaving alone risks falls, supervision is required. Chest pain response excludes. A. Offer reassurance. B. Stay calm. C. Give water, lie flat. D. Call for help. Correct answer, C. Give water, lie flat. NPO status until assessed, semi-Fowler's position is better. Pressure sore prevention excludes. A. Change soiled sheets. B. Reposition regularly. C. Extra blankets. D. Smooth sheets. Correct answer, C. Extra blankets. Blankets don't prevent pressure, they may cause overheating.